Thank you for joining. We will be talking today about the National Survey of Early Care and Education, which we will refer to as NSECE to save a few syllables. This study is sponsored by the Office of Planning, Research, and Evaluation in the Administration for Children and Families. Our federal project officer from the start has been Ivelisse Martinez-Beck, and we also have been working with Anne Rivera and Elizabeth Schuring. As you may know, if you have encountered the NSECE previously, there was a large team that worked to design and execute the study, and many people within the team and now outside of the team have been analyzing the data and sharing the findings with the research and practice communities. This slide lists some of the people who were part of that team, including the principal investigator, Bob Gerga at Chapin Hall, and the three co-principal investigators, Ann Whitty, Lisa Janetian, and Rick Brandon. We will be making the slides available, the whole webinar available for download later for people who are unable to attend today or who really just want to go through it all again. Okay. Our plan for the day is to talk briefly about the NSECE Household Survey, which is provide enough of an overview to allow people to understand the details, but we are primarily expecting that listeners will have already had an opportunity to be familiar with the general study design through many of the materials that are available on Research Connections about the study, including study design, sample design, instruments, data collection description, and many analyses and tools to help people use the data properly. Our primary focus today is on the extensive information about ECE arrangements that are available within the NSECE Household Survey. We'll be talking about 4 categories of attributes of arrangements. Those are the type of care, the cost of care, the schedule of care, and the distance between the household and the location of the arrangement. We'll close with a few issues, ideas, considerations, some special populations, or some cautions that we'd like you to think about as you work with these data. We are scheduled for 90 minutes. We're hoping that we'll get through the material in no more than half that time so that we can spend a good bit of time answering questions that you all might have about how these data can be used. So the National Survey of Early Care and Education was designed during a period from 2007 to 2010. There were 2 primary, somewhat conflicting objectives. One was to really have comprehensive national data about the supply of childcare that was available in the country, as well as the needs of parents and children for that care. At the same time, the national data are very important, but we know that early care and education is used and delivered at a very local level, and the proximity is very important. We wanted to be able to match parents and providers at a local level. And the design, the sample design, ultimately works towards both of those objectives, describing nationally the state of early care and education on both the supply and demand sides, as well as local dynamics of households and their available providers. Specifically, to achieve these 2 overarching goals, the study profiles all families with age-eligible children within a household and in a community. We then stick with that same community to describe all of the care, early care and education available in that community, and that includes especially center-based providers to children who are not yet in kindergarten, as well as home-based providers to children under age 13 years. We further characterize the teachers and caregivers working in both center-based and home-based provider settings. And finally, there's a great emphasis throughout all of the questionnaires and data files on describing place-based aspects of child care provision and use. Roughly speaking, the main objectives each are met through a given questionnaire. And so there were 4 separate surveys conducted in 2012, all of which together make up the NSECE. Today we will be talking about the Household Survey, which was conducted with households having at least one child under the age of 13 years. There are 3 other surveys: the home-based provider survey of individuals regularly providing early care and education to children under 13, the center-based provider survey of programs that provide early care and education to children not yet in kindergarten, and then the center-based classroom-assigned staff survey, which we also sometimes describe as the workforce survey. All 4 of these data sets are available on Research Connections and through ICPSR. They're all publicly available, as well as having restricted use data files. But today we're really focused on the household survey. The household survey was conducted with 11,629 households who combined provided data about 21,665 children under the age of 13. The data are nationally representative. They were collected from January through June of 2012, more so on the early side, January through March, and with great attention paid to make sure that data collection finished before summer schedules began in various communities. There was one adult respondent for this survey. We were looking for the person who was most knowledgeable about the non-parental care arrangements of the youngest child in the household. Generally speaking, that ended up being a mother who was willing to talk to us and knowledgeable about the child's schedule, but there are fathers as well as some other guardian roles within the data file. The NSECE design included an oversample of households in low-income areas, because so many of the important policy questions focus on those households. And so the unweighted data include disproportionately many households living in areas with high fractions of households under 250% of poverty. But the weighted data, of course, generate nationally representative estimates. The household survey ran about an hour in length. The interview, it was an interviewer-administered interview, primarily in person, but in some cases by telephone. This slide shows some of the largest and most significant components of that instrument. The survey did collect individual level data for each of the children under age 13 within the household. And that might include, for example, subfamilies where not all children reported on are, for example, the biological children of the respondent. But if a child under 13 was in the household, we did collect individual data about that child. There is great focus on the receipt of non-parental care during the week prior to the interview. And we'll talk later in the schedule section about that non-parental care calendar. But we did document all of the time in the prior week that each child was with someone other than a parent. Similarly, again, for that prior week, we had a work-related calendar in which we enumerated for each parent or any resident caregiver to the young children in the household that person's work-related activities in the prior week. So any time in the prior week that person was at work, in school, in training or commuting between those activities. We won't really be talking about the work-related calendar today. The household characteristics, things that you might expect, household composition, income, receipt of other program supports, things like that. And then there are also data on perceptions of care and recent search for early care and education. We also won't be talking too much today about these topics, although they will be useful in analyses, presumably, that you might undertake. So we've committed to telling you about ECE arrangements, but haven't yet told you what an arrangement is. An early care and education arrangement in the NSECE is a child-provider pair. The two together determine an arrangement. The child is under 13 years. The provider is not the child's parent, generally also not a regular K through 8th grade elementary, but any other kind of arrangement, whether home-based, center-based, etc. And as we say in the last bullet, that care may be paid or unpaid. We distinguish between regular care or not, and we've defined regular care as that which happens at least 5 hours weekly. And similarly, the care may be in the child's home or not. In addition, we've said that the provider is not the child's parent. One of the categories that sometimes surprises people is that we may have co-resident individuals providing the early care and education to the child. So a parent's care is not considered an arrangement, but if you have an adult sister who lives in your household and cares for you after school, the pair that you and she comprise is an early care and education arrangement. There are some different parts of the questionnaire from which most of the arrangement data come. One of them is something we call the provider roster. The type of care, this provider roster included type of care questions about each provider used either last week or usually, but not last week. So, for example, if you usually have a center-based provider, but last week we're home with the flu, we would have collected information about that arrangement. In red, you see the C1, C3 through C7, C8, C9. Those are references to the question numbers within the household survey questionnaire, which is available directly on the OPRE site, directly from Research Connections. It's also the foundation of what we call the Household Survey Users Guide, which is a substantial documentation resource for users about the contents of the data file and how one might best use and interpret the NSECE data. Okay, so the provider roster has type of care questions, and it also has collected some information about the distance from the sampled home to all the providers. We have another portion of the questionnaire called the child calendar, and that's where we collected the prior week's schedule. Although that portion of the interview took about 40 minutes, it was really one question, C2. And then we had a section on the cost of care, including receipt of public and private assistance, and that was section E of the household survey. One thing that's important to understand is that the information available about ECE arrangements varies within the survey and data files. There are the regular arrangements that were used in the prior week. So these are arrangements that are used at least 5 hours weekly and were also used in the prior week. And for those arrangements, we have the fullest set of information. We have type of care information, cost of care information, distance, and schedule. There are also some irregular arrangements used in the prior week. And by irregular, all we mean is that they are not used at least 5 hours weekly. So this might be a babysitter who does not care for you at least 5 hours weekly, but it may also be, for example, a drop-in childcare offering at a church or a library program or something like that. And then the final major category are regular arrangements that are not used in the prior week. And for those, we still have type of care, cost of care, and distance to care. But since the schedule data are about the week prior to the interview, there are no schedule information about regular arrangements that were not used the prior week. And so one of the things you might find is that depending on which variables you're using, if they're from the provider roster about type of care, the count of centers that are used may differ relative to what would happen if you counted centers that are reported in the schedule data, because there are centers that are in the calendar but did not, there are schedules that are, one more time. There are providers that are reported as being regular arrangements that don't show up in the schedule data because they were not used in the prior week. I apologize for that. Okay, so it's useful, I think, to think about the different levels of data that we have. The NSECE design in general attempted to be extremely comprehensive so that researchers could apply the definitions that you want for your particular analyses. And therefore, there are many, many loops and many, many variants, and you'll really want to be quite conscious of the choices that you make when you subset data for any particular analysis. So within the NSECE households, there are up to 9 children under 13 in a given household. And so a child-level question might be, is this child under 3 in any center-based care? That's a child-level question. You would have up to 9 children, and therefore potentially up to 9 answers within any given household. We also have provider-level data. So we asked some questions about each provider that the household uses once for the provider. For example, how far is this provider from the household? It doesn't matter whether the provider cares for 2 children or 6 children. The distance from the provider to the household should be child invariant. And so that would be provider-level data. There are up to 12 ECE providers for each NSECE household. I'll note that we know that these are not binding limits. The questionnaire was actually capable of capturing up to 12 children and up to 15 providers. So we know that there were no households that were unable to provide their full data because of questionnaire constraints. This just happens to be the maximum that any of our 11,600 households actually reported. So multiplying the 9 by the 12 gets us the number of possible arrangements per household. And so you'll find that there are many variables within the data that are indexed up to 9 times up to 12, meaning that there will be that many different instances of the variable, one for each possible arrangement. And so an arrangement level question would be, how much do parents pay for this child at this provider? So we did collect the cost information at the child level. If 3 children are receiving care from the same provider, we asked about cost for each child separately, if the parent was able to offer it. And this arrangement level is our primary focus for today. And then at the household level, we can roll up the children, we can roll up the providers, we can roll up all these arrangements to generate a household level question such as, what is this household's weekly out-of-pocket cost for regular early care and education? Okay. So I think we'll pause there to see if there are any questions that people have. It's pretty important that the information so far makes sense to people because we'll now launch into the specific variables and throw around words like arrangement and provider with abandon, and we want to make sure that people are not confused as we do that. Jill, do we have any questions that we should address at this time?
Yes. There is one question that just came in. It says she is wondering, do you collect language preference data?
Okay. And so I'm going to answer about languages. We do collect information about the language that is spoken in the household, as well as I think there were questions in the search section about whether language or cultural issues were a factor that the household considered in searching for care. You can also find out what language the interview was conducted in. The provider data that we're not talking about today, the center-based household and workforce data files, all have additional information about the languages used in care, but there is nothing at the arrangement level about the language of care or instruction. Are there any other questions, Jill?
Not at the moment.
Okay. Calling on Jill makes me realize that I didn't actually introduce myself. I am Rupa Datta. I'm the project director of the NSECE, and I will be guiding us through the ECE arrangement data today.
We do have one more question.
Okay.
Susan was asking for time periods. Sorry.
For time periods that children are not in non-parental care.
Do we know for sure what they are in? That they are in parental care? Could they be alone? Also, when in non-parental care, do we know which parent?
We'll talk more about this when we get to schedules, but briefly, we don't entirely know if children are for sure in parental care. We did make several different attempts to code self-care from a variety of sources, and those data are available within the calendar, but there are some gaps, and along the same lines, we do not know when a child is in parental care which parent the child is with. We quickly determined in our developmental work that parents are utterly unable to report when a child is with one or another parent in a household. That was an objective that we pursued at length in the design phase, and found that households, for the most part, are really entirely too fluid to report that in self-report. Okay, I'm going to go ahead and move on to the type of care data. Okay. So just to give you an idea, this is the type of preliminary descriptive work that one can create from the NSECE data. You've seen it from other data sources. We're asking of 4-year-olds what percentage are in any regular early care and education arrangement. We also document by specific types of regular early care and arrangement, and we array that information by 3 categories of household income to poverty ratio. And as you see, for example, among households living below the poverty threshold in 2012, 64% of children aged 4 years old at that time did have at least one regular early care and education provider. And the highest bar there, the one furthest to the right in the less than 100% panel, indicates that 42% of 4-year-olds living in poor households did have a center-based early care and education arrangement. If we move to the far right, we see the comparable data for households at 300% or greater, and among them, the incidence of any regular ECE care is much higher. 86% of 4-year-olds in those highest income households had at least one regular ECE provider. And again, going to the farthest right of those bars, we see that 69% of them had a center-based ECE arrangement. As you'll see as we talk about these data, the arrangement data are suited for children to have multiple arrangements, and so there may be the same child in different of these bars that you see, both in individual unpaid, for example, as well as center-based. So this is an illustration of one of the types of analyses that you can do with the data, and now we'll talk about how we get to those data. Okay. So we have what we call the provider roster variables. An important aspect of the design of the NSEC was that we did not go in with any presumptions about what the type of care categories would be. In our scan of the prior literature, we had found that there was extensive variation in what categories of care different studies had used, and we wanted to construct data that would be amenable to reclassification in a variety of forms. And so our approach was to ask about a variety of elements, each of which would then inform a likely classification of care. So the provider roster variables you see here and some of the other information we have is fixed. We can't go back and ask new questions of those 11,600 households. However, the choices about how to combine them and how to organize and sort the arrangements that come from them are very, very much up to the researchers. I'm going to present you the choices that we've made and that we facilitate through created variables within the data files, but in large part, researchers can choose to go back and reclassify the data in a totally different way, and most of the raw information is still available for people to create an alternative classification and still be able to generate cost, schedule, and other pieces of information about that. So the raw variables that we had were first, whether the provider is an organization or an individual. Secondly, we talk about whether the child had a prior personal relationship with the provider. So this could be a blood relation, a social relation, like a neighbor or a church acquaintance, but any kind of prior personal relationship. We determine whether the care is in the child's home or in another location. We ask about single type activities, and this is maybe a little bit easier to think about in the context of school-age care, where one might have a tutoring program or a basketball. Whereas your traditional after-school program might have some athletics, some art, maybe some homework time, and that would be a multiple type activity. In our center-based provider study, we restrict to providers that provide multiple types of activities. And so there is a single type activity indicator. Similarly, we ask about drop-in care, which means is there a prior enrollment process required? And if there is no prior enrollment, then it's drop-in care. Does the family pay for the care that is received? Is the setting an elementary school or not an elementary school? And is the care at least 5 hours weekly? And that one is the regular, irregular, and we consistently use regular to mean at least 5 hours weekly. So these are the various elements that we had in our data that we asked primarily at the provider level. So once per household, for each of the providers who provide care to the household's children. From those elements, we have chosen to construct the typology that I'll describe right now. And that's based both on our desires to be comparable to the provider data that we collect, as well as to have adequate sample sizes to be able to report on the primary types of care that we identified. So we wanted to be able to partition the data in ways that are both substantively meaningful, but also can be supported with the data that we have. The column to the left is labeled aggregate type of care because we do have a more detailed type of care variable that I'll talk about shortly that you could reclassify in various ways. But these are our 5 aggregate types of regular non-parental care. This is the set of arrangements about which we have the most information. So the first is individual, no prior relationship, paid care. So our traditional family child care business would typically fall into this category if the child had no prior relationship to the provider, but so would a nanny whom you hire from a service would also be an individual with whom you had no prior relationship and whom you were paying to care for your child. The next category is individual prior relationship paid. And so here the difference is whether there was a prior personal relationship or not. And in category 2, there was a prior relationship. We have discussed these individual care categories a bit in the home-based provider, characteristics of home-based provider report that's available. Those categories are different, but those analyses help us understand that many families pay, for example, a family member to care for their child. And so this category could include a neighbor or a family child care provider with whom the family had a relationship and who was paid for care, but it can also be a grandmother who is being paid by the parents to care for her grandchildren. The third category is individual unpaid care. The fourth category is center-based early care and education. This is only care for children under 72 months. So we've restricted it to be about young children. And it corresponds to our center-based provider sample and basically covers the universe of what we think of as center-based care. Head Start, public pre-K, community-based child care, anything that's not drop-in or single activity and occurs at least 5 hours weekly. The fifth category is a little bit hard to understand, other organizational early care and education. The easiest thing to recall about this category is that any child over 72 months in center-based care is in other organizational early care and education, so any kind of school-based after-school program. If you're in a child care center that also provides school-age care, the older children are receiving other organizational early care and education. But it also includes drop-in care, single activity care for any age of child. And all 5 of these categories are for regular non-parental care. In each case, the care must happen at least 5 hours weekly for that child. As a complement, we have 3 + 1 categories of other non-parental care. Elementary school, category 6, depending on what you're studying, many people don't consider it non-parental care. It's elementary school. But this set of categories is especially important because it helps us account for where children are throughout the week. And many children under 13 spend a lot of time in K-8 schooling. So it was important that we have an indicator for that group. And this is K-8 schooling, whether it's private or public. Irregular early care and education, category 7, is any kind of arrangement that the parent reports that happens fewer than 5 hours weekly. It could be intermittent sick care, it could be casual babysitting, it could be either center-based or home-based. Category 8, all other setting unknown. With survey data, you will always have some arrangements that you can't entirely make sense of. Fortunately, they are quite few and far between, but we know these to be regular arrangements, and we really can't even tell you if they're individuals or centers. Unfortunately, there are very few of them. And the last category, 9, parental care, is of course not non-parental care, but it does help us complete the calendar and account for every moment that children spend of their week. And so the parental care category really is just a holding place for any time that a child was not in non-parental care over the course of the week. And as the question foreshadowed, the question from the researcher, the structure of the questionnaire was to ask about any time that a child was not with a parent. And so residually, any time remaining is with parental care. We did not specifically ask respondents to report times when a child was with a parent. We only asked parents to enumerate the times that children were not with parents. Okay. The aggregate types of care are built up from a detailed type of care code frame that we have. That code frame was built from an extensive process. It began with the provider type questions, which we've already looked at, the individuals and the organizations and the payment status and all of those kinds of things. We had a feature called the provider lookup. And so the entire NSECE provider sampling frame, which was the list of every listable early care and education provider we could identify in the country, every licensed entity, every Head Start, every accredited pre-K program, everything we could find was in a table. And interviewers attempted to find each provider in that table. So if you said your child went to the Taylor Road Head Start in whatever town, then the interviewer would first look in our provider lookup to identify that provider. If the provider was found, then we have additional information from the sample frame, including the address of that provider. And that's, we use both the sample frame information as well as the address for various variable criteria. In the event that a provider was not in the provider lookup table, which is most common if it's either an individual provider or some provider that doesn't provide regular licensed care, like a church that has a Sunday morning childcare room, then we directly collected the address. We then used a variety of information this variety of information to date to classify the providers according to a taxonomy that first segmented individuals from organizations, took into account payment status, variety of things. One thing to recognize is that different children in a household may receive different types of care from the same provider. An easy example of that is that my 3-year-old may go to Taylor Road Head Start, and her older brother, who is 4, may go to the Taylor Road, same building, pre-K program, which is run by the elementary school, for example. In which case, the address is the same for both providers, but the provider type would be different for the Head Start versus the pre-K. In doing a lot of this work, there's a lot of information that needs to be reconciled. We used the age of the child to inform our choice, as well as many other pieces of information. Does the sample frame indicate that a Head Start is located at this organization? When we assigned what we believe to be our best choice of P-type, we also assigned a quality flag, 2 quality flags actually, that researchers can use to decide when they actually believe something is a Head Start or not. There is substantial variation in the certainty which we felt in assigning these codes, and researchers may well want, for some purposes, to exclude more uncertain arrangements or to reclassify those. The variables that one would want to look for here, again, the red indicates that it's an actual variable name. The household type of care is the detailed type of care variable. It has dozens of codes. The _X, _Y is used for all arrangement level variables. The X's index the children, and the Y's index the providers. Those detailed types of care variables are then summed up into the aggregate type of care variables, which are the ones that I discussed earlier. There are only 9 aggregate types of care, although, as I said, there are dozens of detailed types of care. But again, there is an aggregate type of care value offered for each arrangement, each child, and each provider. The best P-type quality flag is how we read the next variable name, indicates how certain we are about the quality of the assignment of type of care. And the BP source flag, again, the best P-type source flag, is another refinement of that because it tells you the source of our coding. This is particularly important on the center-based or organizational side. So, for example, we might have a center that we found in our provider lookup. It was marked as a Head Start. All the information coincided. We have tremendous confidence in our assignment of that arrangement as a Head Start arrangement. And the coding type source there, I think, would be provider lookup. We're really confident about it. A second type might be where the respondent reported a center, but it wasn't in our provider lookup, perhaps because it had opened since our frame was built. But we were able, through searches, to confirm that there is a center at that location. And maybe even that it has a Head Start program. We might have, so that you could find in the coding type that you would see in the firm. Then you might have another case where they named a center that we can find no evidence of anywhere. We've coded it as a center because they told us it was one, but we really have no ability to confirm that it's a center. And, similarly, maybe we know it's a center, but we can't confirm that it has Head Start funding, things like that. So, for more detailed discussion, especially of revenue types and especially in organizational care, these two flag variables can really help researchers refine the choices and perhaps correct preliminary assignments that we've made of arrangements to different types of care. One of the things you can do with these data is to look at combinations of care that children are using. So this is just another illustration slide. So what we did first was to look at children who had any regular care arrangements, and we're focused here on children 0 to 35 months. So of children who have any regular care arrangements, we see in the first 5 rows that many children have only one regular care arrangement. They have only, in the first row, individual, no prior relationship paid care, or roughly the same proportion, 5% versus 6%, have only individual prior relationship paid care among their regular care arrangements. After those first 5 rows, we list the most common most common combinations of regular care arrangements. So in row 6, you see individual paid prior relationships, so maybe we pay Aunt Judy, and individual unpaid arrangements. So maybe we pay Aunt Judy, but we don't pay Grandma. And each of them cares at least 5 hours a week for the child. And we see that 2% of children 0 to 35 months have that combination, one prior paid and one unpaid. At least one prior paid and at least one individual unpaid. And then in the lower rows, we see the children who have no regular care arrangements. Even among them, there are children who have irregular care arrangements. And we see that 12% of children 0 to 35 months have only irregular care arrangements. It's possible that the children in the upper rows who have regular care arrangements also have irregular care arrangements, but for designating combinations of care, we felt that the regular care arrangements deserved priority, so we discussed combinations first within regular care arrangements, and only of those not receiving any regular care arrangements, we talk about those who have either only irregular care arrangements or only parental care. And you see in this slide that 38% of children 0 to 35 months had only parental care to report at this time. So this is, again, just an illustration. One can think of many other ways that you could choose to do this. Maybe you disagree with our segmenting the regular care from the irregular care. It's certainly possible that in the first row, that 5% of children who have only a regular individual, no prior relationship paid arrangement also have an irregular care arrangement. And so you can make many other different kinds of combinations. This is one example of the types of combinations one can construct. I think we are about to move to a next topic. Do we have any new questions?
No new questions have come in during that segment.
Okay. I feel like we should stop for a calisthenics break or something, but we didn't prepare the webinar for that, so we'll go ahead. Yes.
We have a question now.
Okay.
Are the combinations of care variables available that you used?
We currently do not have any combination variables on the public use data files that I can think of. We are expecting that OPRE, hopefully in the next couple of months, will be releasing tabulations from which these tables were derived that provide extensive information on how to construct them. But that's certainly something we could think of adding if there were interest in providing and having a consistent set for researchers to use. Okay, I'm going to move on to cost of care. The measure that we have is parental out-of-pocket costs. So obviously it costs centers a lot of money to provide care. It may even cost grandma foregone wages to provide unpaid care. But the household survey does not at all address any of that. All we're focused on is what are parents paying out of pocket for the care that they use. So what we have is weekly direct charges plus any copay amount minus any subsidy paid directly to the household. So each of these components, weekly direct charges, copay amount, subsidy amount, are each directly captured in the data, and we have summed them to create a cost of care variable, which is mostly what I'll be talking about. The cost of care data are only available for regular arrangements, and including those that were not used in the prior week, but only for regular arrangements. We want to note that cost to the household may be zero, maybe because an outside person or agency pays the provider for care, for example, a Head Start, or because no parents are charged for that care. And another example is grandma isn't charging anyone for that care. There was some imputation done for a handful of center-based arrangements and other organizational arrangements for which complete data were not available. We have an imputation flag. The variable name is listed here, available to researchers to identify those cases. In general, in the NSECE data, we've tried to provide these kinds of quality flags throughout whenever we touched a variable so that researchers are able to make their own decisions and rethink some of our choices if you wish. I mentioned before that we did collect arrangement level cost data, and so we asked parents to report how much they were paying for the care for each child that was receiving care from a given provider. This is generally not so hard for parents to do, for example, in a center-based setting where there is a cost schedule. But particularly in home-based settings, it may be that there is a fixed amount that the parent pays the provider each week for all of the children being cared for, and there is not a designated distribution. If the parents did not provide us a formula for allocating the costs across children cared for by a single provider, then we did distribute the amount equally. So if they said they were paying $200 a week to a provider and there were 3 children, we just assumed that each child's care cost $67 per week when there was no other information, although we did ask parents to provide more detailed information if they were able. And we also want to note that cost can be negative. This generally happens, it can only happen if there is a subsidy as part of the package. And so if for some reason the parent is receiving a payment back that exceeds their out-of-pocket costs, then they would have a negative cost of care. This is relatively rare. Okay, that's it on cost. There are additional variables on assistance of public and private subsidies that are also related to the cost of care. Okay, schedule of care. We mentioned that there was an extensive non-parental care calendar, which took up a huge portion of the interview time. And so, roughly speaking, what happened is that the parent, the respondent, would be asked, so let's think about last Monday, the 10th. Who was the first person who cared for little Bobby that day? And the parent would say, well, his uncle. And then we would ask, well, what time did that provider start caring for the child? When did care with that provider end? And who was the next person to care for, or where was the child next cared for? And this would go on for the entire day and, in fact, the entire week. We have these raw data, but we have converted them into what we call the calendar data, and this is a visual, simplified visual explanation of how this might look. So in this mythical household, we have 2 children, and we've arrayed their schedules by the time on Monday. And so, for example, at 8 a.m., we see that child 1 was on a bus, while child 2, his or her sibling presumably, was being cared for by Grandpa Joe. And then at 8:15, child 1 has arrived now at Bright Horizons to receive center-based early care and education, probably. And in the meantime, child 2, I guess Grandpa Joe walked child 2, or drove him, to Eagle Head Start. And so in the data, depending on what you were looking at, you might see that both children were in center-based care, or you might actually be looking at the unique provider ID that each child, Bright Horizons might be provider 2 for this household, and Eagle Head Start might be provider 4 for this household. What you cannot for sure see is Bright Horizons or Eagle Head Start. We will have used that information to create the variables that you have, and certainly if a researcher had a good research idea that would require us to go back and retrieve the provider names, it is possible to do that through our restricted use process. But generally, as a researcher, you would see a type of care or a unique provider ID. To be more informative on this slide, we've tried to spell out what's happening. There was an earlier question about when would somebody be in self-care, or how do we know for sure that they're with a parent? And this red gap check for child 2 is an illustration of one of the ways that we would go about doing this. So we would compare where a child was with what the parents were said to be doing in their calendars. And the computerized interview was programmed to say, wait one moment, child 2 is supposedly not with any non-parental care provider at 3:30, and both parents are at work at that time. And so where was child 2 at that time? And it's possible that child 2 was actually with mom at work, and that would be one of the clarifying comments. Since child 2 is in Head Start, we're presuming child 2 was not in self-care, but that would also be a potential clarification, perhaps for an older child. Okay, so the schedule variables are found in a variety of places. There are separate calendar data file. So for the most part, the constructed variables that are available are fairly limited, but there are virtually infinitely many possibilities for what one could construct using the available variables. For example, you could construct the number of hours in a reference week that each arrangement was used. You can distinguish evening or weekend hours from daytime hours. You could, for example, look at all of the non-parental hours a child used or experienced in a given week and say, well, 60% of them were center-based and 20% of them were unpaid individual and 5% of them were irregular or whatever. So these are some of the ways that one could approach these data. Here are a handful of useful calendar-related variables. There are some children who are missing at least some portion of the child calendar data. This is fairly common. It's a little bit more common in the school-age children than in the young children, and there is a flag so that you can easily pull them out if you want to exclude them for your analysis. Similarly, we have a flag. All of these red quote-unquote words are the actual variable names. There's a flag for if the household uses only parental care. I mentioned earlier that we have a unique provider ID within the household. You can't match them across households, but within the household, every provider has a number. And if you look in the calendar data, what you will see is that, child 2 at 2 o'clock on Tuesday was with provider 13. And then you can go back and look in the other data sources to learn other things about provider 13. So that HHP type _X is a helpful variable if you're trying to get more detail on the providers. Okay, so now we have distances. I mentioned earlier that the way that we collected, the way that the distance data are derived is through identification of the provider location. So we only have distance data for regular ECE providers. For them, we attempted first to identify them in our provider lookup table, which was our sampling frame. And if we found them there, then we use the official address that we found in our data. If they weren't in the provider lookup, then we asked the respondent to report the address. And even there, they could report a street address, an exact street address, or even an intersection that was near the provider's location, the way that you might in, Google Maps. If you were asking for directions, you might say, well, I'm going to start at the corner of, Main and East. Tell me how to get there. I will note that the location data are disproportionately missing for individual providers, especially those with prior personal relationships to the children. So respondents are generally not averse to telling an interviewer that, the Head Start is at a certain location, but they may not want to tell you where Aunt Anne lives. So the data that are available using that provider location and using the home address, which we know because we sampled it, are a categorical variable that classifies the distance from the home to the provider, and I think the categories are the provider actually provides care in the home, or less than a mile, up to 8 miles, and then more than 8 miles. So that's a categorical variable. The NSECE has a range of restricted use data as well, and so what we call level 1 restricted use, which can be received from ICPSR, does include a continuous distance measure, so you would be able to see there that a provider was 1.3 miles from the home instead of just between 1 and 2 miles. And then many, many other variables are possible, for example, through what we call our level 2 restricted use, which is a remote access program. You could request distances between the different providers. How far is the first provider from the second provider? We also have parental employment location, and so one could construct the distances from parental employment to the different providers. There are many other possibilities that would need to be requested. They don't exist currently, but are feasible. Here again is just a basic illustration. This is the average distance from a child's home to center-based care by dividing up children below and above 3 years and differentiating by household poverty. You see, for example, that young children travel on, the distance for young children is on average about 4.6 miles from home to center, and it declines slightly to 3.9 miles for 3 to 5 year olds. You see a somewhat steadier incline by income among the older children, whereas among the younger children on the left, you see two income groups, the lower two income groups, roughly close to one another, below 4 miles, and the higher two income groups, roughly close to one another, just above 5 miles. An important thing to remember, of course, is that use of center-based care varies across these income groups, as we saw in one of the first slides. And so this is, among people using care, this is the kind of distances that they're traversing. A few comments that we felt should be made as we're...
We have a question about distance.
Oh, okay.
How is distance defined in other, for example, draw a straight line between 2 points, or is it road distance?
Yeah, it actually is as the crow flies distance, which of course in many cases is not the actual distance if you're fording rivers or crossing highways. So the distance that is in the data file is as the crow flies, but again, if one wanted to use mapping software, it would be possible to generate other distances. Thank you. A few other issues to comment on. School-age children. So the household data includes thousands of children in elementary school or middle school, and the calendar data for them are particularly fascinating, I think, because we know relatively little about what school-age children are doing outside of school. And so, for example, it's possible to look at incidents of self-care. And another question that we don't know of any other reliable data on is really of these multi-site licensed arrangements that provide a lot of subsidized after-school care. How do they compare to other types of center-based activities that families may be using for their school-age care? So, for example, I have school-age children who go to ballet class or robotics programs, and those activities serve as childcare for me, but they are single activity or in some cases drop-in. And so the NSECE calendar data together with the type of care data really provide an extraordinary opportunity to understand what school-age children are doing before and after school, and the extent to which some of the traditional licensed forms of care, licensed and regulated forms of care, cover that universe. Household level information also, the design of the NSECE offers some really interesting opportunities for further analyses. I mentioned this HHP type _X variable, which identifies providers uniquely at the household level. And so in particular, you can use it to identify when the same provider cares for multiple children in the household. So I think we've had this question before. Can I tell either when different children, how many unique providers a household has, or does one child have more than one center-based care provider? Both of those questions can be answered using these data. Another thing, because we enumerated every child under 13 in the household, we can look at whether the presence of, say, school-age children alters the choices that parents make for their younger children's care. Do you, move to centers that are closer to the elementary school once your older children enter school, or are you more inclined to resort to individual care if you have both school age and preschool age children? Those kinds of things. And this is a huge potential area that the NSECE data are quite well suited for. The parent-like relationships is either a tremendous opportunity for research or a cautionary tale. I'm not quite sure which it is. Respondents had some discretion in determining what was parental care versus non-parental care. Obviously, in most cases, it seems like it's kind of black and white. But one example would be care by a non-custodial parent. And so if on Tuesdays a child is cared for by a non-custodial parent, so somebody not in the household, that care actually in our data is classified as non-parental care. That person should have been assigned a provider ID and treated as not providing parental care within the household, because our parental care is focused on the parents within the household. A second item is care by the parent's spouse or partner within the household, especially in households where not all children have the same biological parents. So you may have a setting in which, say, there is a mother and her partner. They together have a biological child, and she also has a child from a prior relationship. If they're being cared for together at the same time, you may think of that as either they're all getting parental care, or one of them is getting non-parental care and one of them is getting non-parental care because of their relationships. That kind of situation, we haven't really looked carefully within the data to understand, and we expect that there might be some inconsistency depending on how parents were reporting those arrangements. And a final example is when the primary parent figure or guardian in the household is not a parent. The easiest example of this is, of course, a grandparent household. In that case, we generally advised that the guardian was providing parental care, that all children have the opportunity for parental care in the sense that the person who is their custodial guardian is caring for them within the household. So we would expect that a grandparent who is the primary guardian would be classified as parental care, but that might vary in some settings, and it probably is easiest to segment off those households by household structure first and then investigate further. So as I said, these are all tremendous opportunities to understand how families with some of these composition features are operating, but it's also a caution that researchers might want to be careful in interpretation, because there might be some nuances in how some of these situations worked. We've covered a lot of ground today. The NSECE resources page at Research Connections is a tremendous resource with webinars, documents, research reports, questionnaires, videos, everything that we've done today. That information, as well as to let us know when there's something you'd really like to see that's not there. That kind of request, as well as clarification questions about the data, can be addressed to the nsec@norc.org email address that you also see on this slide. I think we've made it through our intended content. Do we have any newer questions?
I see someone is typing.
Okay. If they...
Yes. Is there any parental children health or disability data?
There are limited data about the child's disabilities. There are two variables that are intended for people to use for the identification of children with disabilities. The variables are quite weak. Does so-and-so have a physical, emotional, developmental, or behavioral condition that affects the way you provide care for him or her? This is not how anyone would advise you to identify children with disabilities, although in some preliminary tabulations that we've done, the incidence rate is actually quite close to what we found in other data sources. And so that's where we would look. For parents, I don't know that there is much about parental disability other than a question that asks whether they're able to care for anyone. I'm sorry, I'm not finding it right now. I think there is one question about whether a parent is capable of caring for another individual. And that's asked for every household member. The user's guide, which is available on the resources page, does list all of the variables in both the public use data as well as the first level of restricted use. Any other questions?
I don't see any more.
Okay, well, maybe we'll just do one more tantalizing slide, hopefully, while people are thinking of their questions. And so one question that I think we often contemplate when we think about combinations of care are the extent to which a combination is because parents are supplementing care or they're substituting care. So center-based care and individual unpaid care is one of the more common combinations. So we might think of a child who's in preschool and spends the rest of her day with grandma. And a natural question is, well, does having grandma mean that you don't spend as much time in center-based care, and so you can get picked up sooner and leave sooner? Or is it that the children who have combinations of care need that many more hours of non-parental care, and so they're spending the same amount of hours in center-based care plus additional hours in individual unpaid care? This is a natural question that one might ask. So this slide takes a little bit of time to make sense of. The blue bars show us the number of hours that children 0 to 35 months spend in center-based care if that's their only regular arrangement. So, for example, the leftmost bar tells us that poor children, those living under 100% of poverty, spend, on average, 32 hours per week in center-based care if they have exactly if their only regular arrangement is center-based care. Okay. The red bar tells us how many hours children spend in center-based care if they have both regular center-based arrangements and regular individual unpaid arrangements. So the blue bars are children who are only in center-based care. The red bars are children who both have center-based arrangements and individual unpaid arrangements. But in both cases, we're looking at the hours of center-based care each week. So again, with those left side bars, we're seeing that if you have an individual unpaid arrangement, you're spending about 4 hours a week, 5 hours a week fewer in center-based care, 27 versus 32. Okay. Roughly, visually, we see the same in the next income group from 100 to 200%, and in the fourth income group, greater than 300%. In all of those cases, children 0 to 35 who are only in center-based care spend a little bit more time in that center-based care than do children who are in center-based care and have an individual unpaid regular provider. In contrast, in that third batch of bars, the 200 to 300% of household poverty, here we see that children who have an individual unpaid arrangement actually spend substantially more time in center-based care than do the children who are only in center-based care. If you're only in center-based care, you're spending 28 hours a week in that arrangement. If you have both a center-based and an individual unpaid arrangement, you're spending 37 hours per week in the center-based arrangement and then additional hours in the individual unpaid arrangement, which we're not seeing here, which suggests, for example, going back to my initial framing, that in 3 of the income groups we're looking at, we do see some modest evidence of substitution, that maybe grandma does pick you up early. But in that third income group, we don't know if there's supplementation, but for sure, you are not spending less time in center-based care because you have an individual unpaid arrangement, and perhaps actually the need for more hours of non-parental care is greater in that group. We can't tell that just from this slide. All right. Well, hopefully some of this information helps you think about how you might use these data. Do we have any other questions?
There are no more questions that have come in.
Great. Well, we will be archiving this webinar. We welcome your questions to the NSECE mailbox, as well as your visits to the NSECE resources page. We hope to be bringing other topics to you in the future and would welcome your input about topics that would be of interest to you or tools that would help you use the data. Thank you for spending your time learning about the NSECE.